So today we're going to demonstrate the use of Restylane for lip enhancement. And when I look at this woman, I think the first thing that I would like to do is try to enhance her vermilion border. I can see it, it's well defined, but I think enhancing it a little bit will be cosmetically pleasing, as well as will help prevent lipstick from bleeding up the lines, even though they're very small, but those very small lines on the upper lip. So I'm going to start with that. I like to place my hand and secure the vermilion border, and I like to start from the most lateral part. I usually keep my bevel up meaning towards the mucosa or skin, and I enter right into the vermilion border. I slowly inject and let the material slowly thread right across the vermilion border, and using very small amounts. I haven't even put in 0.1 cc in there. I don't want to get too much projection of her vermilion, I just want to define it. I'll then come back to where I finished off and do one more needle. And I'm right in the vermilion border. I'm slowly letting that inject across. Typically, you may notice a little bit of swelling or edema in that area. So we've now put about 0.1 cc only in the vermilion border on her right side, and I'm going to do the same now on her left side. Same technique. I'm going to open up her mouth a little bit. There's a little pinprick on the corner. And I'm just going to try to go right in that vermilion border and slowly put a small amount of product in. I can see where I've ended. I'm now going to go back, one little pinprick, 1, 2, 3, and a little bit of product along that vermilion. I like to warn the patients before I do any poking so not to scare them or surprise them with my needle. And I can see that even though I've maybe put in 0.2 cc's in total, I have nice definition now of her vermilion border. The next thing I'd like to do is add a little bit of product to the body of her lip to try to roll it out a little bit. Again, on this one, I'm going to use a linear threading technique. I'm going to lift her lip out. And I'm going to slowly inject the product into the body of her lip. You'll see that I go very slowly and try to be very gentle with my flow. And I'm typically above the wet-dry border, putting small amounts of product in her lip. I've now used maybe 0.2 cc's on that side. I don't even think even that much. And I'm getting a nice roundness and a nice definition of that upper lip. So I've put about 0.1 cc in the vermilion border on both sides, and just under 2.2 cc's on her left upper lip. I'm very pleased with how things are going, and I'm going to try to match up the right side of her lip now to her left side. I'm going to do the same technique. I'm going to slowly roll her lip out a little bit. I can see her wet-dry borders right here. I like to stay above that because this is the area I want to enhance. I'm going to slowly put my needle in, and I'm going to use a push-forward technique with antegrade flow of my product slowly. And you see how slowly I'm pushing on that plunger. I really want to do a nice slow flow to try to limit the amount of edema or swelling that the patient gets. Gentle pressure is always nice on any parts after you've injected to help, if possible, prevent any bruising. I think we've done a nice job now of enhancing her upper lip. And when I now finish the upper lip in terms of enhancement, I'll then look at the border of that lip and look and see, as we pointed out earlier, she has some small vertical lines, very, very small. But if we can improve on those vertical lines, I think that would be advantageous for the patient. So what I typically do is I use a linear threading technique, very superficially, very small doses to try to help those vertical lip lines. I will go into that lip line and I'll put a tiny bit of product in. And I'm not even registering that product on how much I'm putting in. I'm putting in the littlest amount possible into those lines. And another one here. And you'll see I'm hardly moving my plunger. I don't want to lift up those lines too much. So I've completed most of the upper lip, and I'm just going to look closely now to see if there's anything I want to fine-tune. I do notice very subtly a slight indentation here adjacent to where I injected her vertical lip line, and maybe a tiny bit there. And it's okay at this point to use serial puncture technique to that area. Small little doses. You'll notice I'm putting in very small amounts of product. And some of that is edema and is going to settle out. Typically, I tell patients the lips will look a little swollen for a couple of days. I tell them to give them at least 5 days, let everything settle, and I can always fine-tune if necessary. So the next thing I'm going to do, I've done a nice correction on the upper lip with Restylane to enhance that. I'm now going to focus on the lower lip. I'm going to start by doing the oral commissure. She points down a little bit on her oral commissure, so I'd like to elevate that. So what I do is I'm going to put a little bit of Restylane in, a little injection, and I'm going to slowly inject, and you'll see I'm actually trying to push the corner of her mouth up. And at that point, I'm going to come across her lower lip and put a little bit in her vermilion border here. And this will help frame her lower lip. And you'll notice now that that corner of her lip is nice. It's in a nice neutral position and has lifted up. I'm now going to put a little bit of product in her lower lip as well to try to enhance the body of her lower lip. So I'm just going to open this up and put a little pinprick in. 1, 2, 3, ouch. And a linear thread in there. So we've now injected the lower lip on her right side. I'm going to do the lower lip on her left side. I'm going to put a tiny little bit of product in the corner just to lift this vermilion up a little bit. And a little bit of product up there. And then I'm going to put a little bit along the vermilion border of that lip. So that frames that nicely. And now a little bit into the body of her lip. I'm keeping the needle in the middle of her lip, the body of her lip, and I'm trying to stay below the wet-dry border, meaning towards the vermilion of the wet-dry border, just to enhance that a little bit. Now we'll look and see how we're doing with respect to symmetry and balance of her upper and lower lip, and to see if anything needs to be fine-tuned to try to get nice, proportionate, and well-balanced lip augmentation. So now I've completed, I think, most of it, and I want to have a fine-tune and look and see if there's anything that I want to fine-tune or change. And I look at her, I think we have really nice balance, good symmetry, bottom lip a little bit bigger than the upper lip, nice corners of the oral commissure, size and shape I like of the upper lip. On the bottom lip, I think a little bit of asymmetry, a little bit more product right in here. And I'll use a serial puncture technique there. I'm just going to get open the mouth a tiny bit, and I'll just put a tiny little bit in. And a little bit of product into there. Not even 0.1 cc. So I'm being really finicky as much as I can. When I look at her lip, I think we've done well with balance and shape. I think maybe on this left-hand side of her lower lip, she could use a tiny bit more. I think it's okay to use serial puncture technique, a little pinprick here, just to put in not even 0.1 cc into that area. And I think maybe just a tiny bit more just in that corner. I think now we can see that there's nice enhancement of this woman's lips.